Welcome back to Anatomiqa. In the previous session, we discussed the histology of bone. Please recall what was discussed under histology. We recapped the functions of bone, components of bone, general arrangement of the components, and the two sections, transverse and longitudinal sections, were discussed. In this session, I will be discussing various aspects of bone fracture and repair or healing. The learning outcomes of this session are: describe the types of fractures, list the common types of fractures occurring in each bone, mention the stages of fracture healing, explain the changes that occur during fracture healing, list the factors that affect bone healing and remodeling. Fracture of bone means a break in the continuity of a bone. The continuity of the bone is disrupted in one or more places by a crack or a break. Fractures might occur if bone is subjected to extreme loads, sudden impacts, or stresses from unusual directions and is easy to occur in individuals with brittle bone disease. The consequence of fracture is damage to cells, blood vessels, bone matrix, surrounding soft tissue, and periosteum. Fractures are classified based on the complexity, location, and other features. There are many different types or categories based on the location and exposure of broken pieces of bone to external environment. The following are the types or categories of fracture: non-displaced fracture, displaced fracture, open type fracture, closed type fracture, and pathologic fractures. There are several patterns of fractures occurring in the bone depending on the shape and the number of breaks, irrespective of the types or categories of fractures. The following are the patterns of fractures: green stick, oblique, spiral, transverse, compression, segmental, comminuted, avulsion, linear, and buccal. Let us now see the brief details of each type of fracture. Non-displaced fracture. The bone breaks but does not move out of alignment. Both pieces are aligned in one same plane. Displaced fracture. Bone breaks into two or more pieces and moves out of alignment. Two ends of broken bone do not stay in straight line. They are in different planes and directions. Open fracture, also called as compound fracture, is connected with the skin wound. Broken bone breaks through the skin and sometimes is visible through the wound in the skin. They can become infected. Simple or closed fracture does not communicate with the skin wound. They do not penetrate the skin. The skin is intact but can harm the surrounding soft tissues, resulting in fracture blisters. Pathologic fractures. Fracture caused by a disease that weakens the bone like osteoporosis. In addition to whether the bone is displaced or non-displaced or closed or open, it will be given a fracture pattern name. Green stick fracture, an incomplete fracture in which the bone is bent. The broken bone is not completely separated. This occurs most often in children. Oblique fracture is the diagonal break across the bone. The break has a curved or a sloped pattern. Spiral fracture. One part of the bone has been twisted at the break point. The break spirals around the bone, common in twisting injury. Transverse fracture. The break is in a straight line across the bone. The fracture of bone is at right angles to the bone's long axis. Compression fracture. The bone is crushed, causing the broken bone to be wider in appearance. Usually involves the bones in the back, that is vertebrae. Segmental fractures happen when the bone is broken in two different places and a section of the bone is separated and floating from the rest of it because of the fracture. Comminuted fracture. Break is in three or more places to form multiple fragments. The bone breaks into several irregular pieces. Avulsion fracture. A fragment of bone is separated from the main mass. Bone is broken near the attachment of tendon or ligament which pulls off a piece of bone. Linear or fissure fracture. Break is in one thin line with no additional lines splintering from it. The break is parallel to the bone's long axis. Buccal fracture or impacted fracture. Two broken ends are driven into each other like buckling, commonly seen in arm fractures in children. The healing of a fracture depends on survival of the blood supply and cellular components of the periosteum. Healing starts as soon as bone breaks and it continues to model for months to many years depending the type and pattern of fracture. There are 4 stages of bone healing or repair. The details of 4 stages of bone healing are as follows. Stage 1, inflammation or hematoma formation. The immediate effect of fracture is blood vessels supplying bone and periosteum are torn and there is extensive bleeding and a collection of blood in and around the site of fracture. The blood coagulates to form a clot which is called fracture hematoma. Due to interruption of blood supply across the fracture line, there is lack of nutrients to the bone and bone dies for a considerable distance on each side of the fracture. The site becomes swollen, painful and inflamed. Stage 2, soft callus or repair by granulation tissue. Hematoma is infiltrated or invaded by new blood vessels, fibroblasts and macrophages, and granulation tissue is formed. Some of the fibroblasts produce collagen fibers while others differentiate into chondroblasts and osteoblasts. Chondroblasts begin secreting cartilage matrix. Osteoblasts begin forming spongy bone. Macrophages act together to remove damaged necrotic tissue and secrete cytokines like vascular endothelial growth factor to stimulate healing at the site. The entire structure is now known as fibrocartilaginous callus or soft callus and it splints the broken bone. In this way, repair of fracture ends is established by soft tissue which is known as the temporary callus or the fibrocartilaginous callus or soft callus. Stage 3, union by callus or hard callus or bony callus formation. Typically, this stage stretches for about 6 to 8 weeks. Usually, the different stages will be overlapping with each other. The soft callus will now be replaced through endochondral ossification by the hard tissue called hard callus, which bridges across the fragments of broken bones in the process of repair. During the formation of bony callus, the newly formed collagen-rich cartilaginous callus gets replaced by immature bone. Within a few days after fracture, the osteogenic cells of deep layers of periosteum and endosteum of both fragments proliferate and form a distinct collar or callus around each fragment of bone. Within the collar or the callus, the osteogenic cells differentiate into osteoblasts and chondroblasts. The osteoblasts grow close to the bone in presence of blood supply and the chondroblasts develop in a non-vascular environment away from the bone. The collars or callus continue to grow over each bony fragment. Later, the callus from the two fragments meet and fuse. This causes the union of the fractured ends. The callus may be of 3 kinds: external, intermediate, and internal. External callus appears outside the fractured ends and beneath the periosteum. Intermediate callus lies between the fragments of bones, whereas internal callus appears within the medullary cavity. The external callus presents 3 layers from within outwards. The layer close to the bone consists of bony trabeculae. Intermediate layer consists of cartilage cells and the outer layer consists of proliferating osteogenic cells. Bony trabeculae increase in number and convert the fibrocartilaginous callus into a bony callus of spongy bone. Stage 4. Bone remodeling. Remodeling is the simultaneous process by which bone is removed in tiny increments and new bone is formed. After a fracture, remodeling may continue for months or even years. During the remodeling phase, the oven or immature bone is converted to lamellar or mature bone and the medullary canal is reconstituted. The cartilage cells of the callus are calcified and eventually die. As a result, all cartilage cells are replaced by the continued migration of osteoblasts and osteoclasts to the injured site. Osteoclasts remove the dead bone, a process called bone resorption. New living bone is laid down by the osteoblasts between the broken fragments, rebuilding the compact bone and reconstructing the bone and any extra matrix of the bone laid down by osteoblasts is removed by the osteoclast cells, bringing back the original shape of the bone. This is termed as coupled remodeling. The osteoblasts are then converted to osteocytes as the matrix is calcified. After the bone has formed and the damaged bone has been removed, the bone remodeling process is not yet complete. The body continues to monitor the strength of the bone and will continue to remodel it as needed to ensure it remains strong and able to support the body's weight and movements. Overall, bone remodeling is a continuous process in which new bone is formed, old bone is removed, and the bone is continuously remodeled to maintain its strength and integrity. The bone remodeling process is controlled by various local and systemic factors and their expression and release in a well-organized manner. Local factors which can lead to poor healing or delay or non-union of the broken ends are as follows. Factors independent of injury, treatment or complications. Type of bone. Abnormal bone due to radiation necrosis, infection, tumors and denervation. The local factors depending on injury which can delay the bone healing are degree of local damage, type of fracture, misalignment, extent of disruption of blood supply leading to reduced blood supply to the fractured site, severity of injury, loss of bone, soft tissue interposition, that is, soft tissues caught within the fracture ends, and local growth factors. The local factors depending on treatment which will delay bone healing or non-union of broken ends are as follows. Extent of surgical trauma. The surgical procedure and the type of surgical instrument used can create mechanical and biological trauma to the bones, leading to a temporary increase in bone resorption followed by a period of increased bone formation. This might cause alterations in the normal balance of bone remodeling. Additionally, immobility during the post-operative period as disuse and decreased weight-bearing activity can lead to decreased bone density. Implant-induced altered blood flow. The placement of a foreign body, such as a surgical implant, can cause changes in local blood flow, leading to changes in the oxygen and nutrient supply to the surrounding bone tissue, potentially delaying or inhibiting bone healing. In some cases, implant-related complications such as infection or implant failure can cause further trauma and inflammation to the surrounding bone tissue. Degree and kind of rigidity of internal and external fixation and influence of timing. Internal fixation refers to the use of surgical devices such as plates, screws, and rods to stabilize broken bones internally. External fixation refers to the use of external devices such as casts or braces to stabilize broken bones. The degree of rigidity of the fixation device can affect bone remodeling by controlling the amount of movement and deformation at the fracture site. Excessive rigidity can limit the normal range of motion and prevent the proper alignment of the broken ends, potentially slowing down or inhibiting the healing process. On the other hand, too little rigidity can allow for too much movement, potentially leading to further injury and delaying healing. The timing of fixation also plays a role, as early fixation can prevent further displacement of the broken ends and promote proper alignment, while late fixation can result in more challenging healing and a higher risk of complications. Degree, duration, and direction of load-induced deformation of bone and soft tissues. Loading and weight-bearing activities can stimulate bone remodeling and increase bone density, while disuse and decreased weight-bearing can lead to decreased bone density. The direction of load and deformation also plays a role as bones respond differently to different types of mechanical stresses. Extent of contact between two parts. If the broken ends of the bone are well aligned and in close contact, it can promote proper healing. On the other hand, if the broken ends are misaligned or have a large gap between them, it can slow down or inhibit the healing process, as the bone cells may have difficult bridging the gap. In such cases, additional interventions such as surgery or the use of bone grafts may be required to promote proper healing. The local factors associated with complications delaying the process of healing or non-union of bones are as follows. Infection. The immune response to the infection can cause inflammation and tissue damage. Additionally, infection can cause increased bone resorption and decreased bone formation, leading to a net loss of bone mass. In severe cases, the infection can spread to the surrounding tissue, causing osteomyelitis. In some cases, surgical intervention may be required to clean the infected area and promote healing, and long-term antibiotics may be necessary to manage the infection. Venous stasis. It can occur as a result of immobility, increased pressure on the veins, or a combination of both. Reduced blood flow can lead to decreased oxygen and nutrient supply to the bone tissue, potentially affecting the activity of bone cells and the bone remodeling. In some cases, venous stasis can lead to the formation of blood clots, further reducing blood flow and increasing the risk of complications. It is important to prevent and manage venous stasis in patients with broken bones, particularly those with reduced mobility, to promote proper healing and minimize the risk of complications. This can be achieved through a combination of measures such as proper positioning, compression therapy, and in some cases medication. Metal allergy. It can cause an immune reaction to the metal implant, resulting in inflammation and tissue damage at the site of the implant, affecting the normal bone modeling process. Symptoms of metal allergy can include itching, redness, swelling, and pain at the site of the implant. In severe cases, the implant may need to be removed and replaced with a different material that does not cause an allergic reaction. It is important for patients to be evaluated for metal allergy prior to undergoing internal fixation with metal implants to minimize the risk of complications. We have completed the local factors affecting the bone remodeling. Coming to the systemic factors, where the presence of any of these factors predisposes to poor healing or advanced age. As people age, there is a natural decline in bone density and an increased risk of osteoporosis, a condition characterized by low bone mass and increased fragility. This can make bones more susceptible to fractures and affect the normal bone remodeling process, potentially delaying or inhibiting healing. Additionally, the healing process can be slower and less efficient in older individuals due to changes in the immune system, decreased circulation, and reduced nutrient supply to the bone tissue. It is important for older individuals to maintain healthy bones through a combination of measures such as proper nutrition, regular physical activity, and in some cases medication to minimize the risk of fractures and promote proper healing. If a fracture does occur, prompt and proper treatment is essential to promote the best possible outcome. Obesity. It is associated with the following features: increased mechanical stress on the bones, changes in the hormone and immune systems which can affect bone metabolism, increased levels of inflammation, increased risk of complications. Additionally, obesity can make it more difficult to perform physical therapy and limit mobility, which can further affect the healing process. Anemia. Anemia is a condition characterized by a low red blood count, which can reduce the oxygen carrying capacity of the blood. Anemia can also affect the immune system, which can impact the healing process. Additionally, anemia can make it more difficult to perform physical therapy and limit mobility, which can further affect the healing process. Endocrine conditions such as diabetes mellitus, parathyroid disease, and menopause. In individuals with diabetes mellitus, there may be changes in the immune system, decreased circulation, and reduced nutrient supply to the bone tissue, and additionally, high blood sugar levels affect bone metabolism and potentially delay or inhibit healing. Parathyroid disease is characterized by imbalances in the levels of parathyroid hormone, which regulates calcium levels in the body. Abnormal parathyroid hormone levels can affect bone metabolism and potentially delay or inhibit healing of broken bones. Menopause. Menopause is associated with decreased estrogen levels, affecting bone density and increase the risk of osteoporosis and fractures. Additionally, the healing process can be slower and less efficient in postmenopausal women due to changes in the immune system, decreased circulation, and reduced nutrient supply to the bone. Steroid administration. Steroids are commonly used to treat a variety of medical conditions, but long-term use can have a negative impact on bone health. Steroids can reduce bone density, increase the risk of osteoporosis, and impair bone remodeling. Additionally, steroids can affect the immune system, which can impact the healing process. Malnutrition is characterized by a lack of essential nutrients, including vitamins and minerals, which are important for proper bone health. A diet that is inadequate in calcium, phosphorus, and vitamins D and K can affect bone density and increase the risk of osteoporosis and fractures. Additionally, malnutrition can affect the immune system, which can impact the healing process and make it more difficult to perform physical therapy, which can further affect the healing process. Smoking is associated with decreased circulation, which can reduce the delivery of oxygen and nutrients to the bone tissue. Additionally, smoking can affect the immune system, increase the risk of osteoporosis and fractures, as it has a negative impact on bone density and can make it more difficult to perform physical therapy, which can further affect the healing process. With this, we have completed the fracture and healing of the bone. To recap the session, we discussed about different types of fractures, stages of fracture healing, inflammation, formation of soft callus, hard callus, and bone remodeling, and finally the local and systemic factors that affect the bone remodeling or healing. In the next session, we will be discussing the development and ossification of the bone.